Hi, Macarena.
Hi, good morning.
Good morning. Can you do a quick introduction? I just want to see if we can hear your voice clearly.
Okay. Hello, everyone.
Yes. Yeah, I hear a bit of echo from your end.
Let me try to connect my earphones.
Okay, great. That might help. Yes. Um, Dipti will begin in about a minute.
Okay, thank you.
Over to you, Dipti, now.
Thank you. Welcome, everyone. My name is Deepthi Kochar, and I'm an executive advisor at Esri. I have been with Esri for over 21 years in various roles and support many nonprofit and global statistical agencies. As an advisor to UNDESA, I lead the SDG programs at Esri and support UNFPA for the COVID-19 vulnerability dashboard, as well as the PDP. I also support the US Census Bureau and other global NSOs in the statistical modernization of the 2020 and beyond. This webinar is the 15th in a series hosted by the UN Statistical Division as part of the run-up to the UN World Data Forum. The forum aims to foster cooperation and open dialogue among governments, academia, international agencies, private sector, and civil society, with a big focus on data that can be used to accelerate progress on the SDGs. Our topic for today is the COVID-19 data hubs for timely decision making amidst the pandemic. Before we dive in, a few housekeeping notes. Please remain on mute unless you are designated speaker. We will use the chat function to communicate during the webinar. We'll have time for question and answers after all the presenters are done speaking. We have received a very large number of interesting questions that have helped our conversation today, and we have picked a few that the panelists will address later. The panelists will also respond to some of the questions that will come live through the chat in second half of the webinar. So send your questions to the host privately via the chat window throughout the session, and feel free to have a discussion with other participants in the chat window. Finally, let's find out who is in our virtual room. I invite you to find the chat function of the webinar and put in 2 words, the country you're joining from and the sector you represent, such as NSO, private sector, international organizations, or NGOs. Before we begin, I would like to highlight that the 2020 Virtual United Nations World Data Forum is taking place from 19th to 21st October 2020. The forum brings together very exciting speakers and topics. The program is now available on the forum website, and the registration will be open in September and is free to attend for all. Stay tuned through the forum's Twitter page and the website. The pandemic has been a challenging time for decision makers since they have to respond accurately and in timely manner to mitigate the impact of COVID-19 while keeping the public informed. Countries have leveraged geospatial information systems, or GIS, in unprecedented ways to disseminate data and information during the pandemic. The GIS data hubs have facilitated data sharing, collaboration, and interoperability, enabling countries to integrate statistical and geospatial data to make information available from different parts of the statistical and data systems for various users for timely decision making at the local, national, and global level. Countries, with the help of various partners, have developed COVID-19 data hubs to make data available on the spread of the virus and its economic and social consequences. In today's webinar, we will showcase some of the data hubs developed by countries with global partners as a tool for improved dissemination and data use for diverse audience, and highlight the benefits that come from collaborating among the geospatial and statistical community. We have 3 outstanding panelists with us today. Macarena Perez Garcia, Executive Secretary, National Systems for Territorial Information Coordination, SNIT-STI Chile. Celeste Acajo, Geospatial Data Scientist, Ghana Statistical Service. Elan Alrausan, Director of Electronic Transformation and Information Technology, Jordanian Department of Statistics. They bring tremendous experience and different perspective, and I'm really looking forward to hearing from them today. So before we turn it over to them, let's see who is in our room. So I see people from Mexico, INEGI have joining, UNICEF, MENA Regional Office, Thomas from Philippines, and also some very various agencies, also WHO, USICA, and UNDGIM. Excellent. So let's get started. To start us off, I'm pleased to introduce Elan El-Rousan. She has worked at the Jordanian Department of Statistics for over 18 years in various technical and management roles, and currently as the Director of the Electronic Transformation and Information Technology Directorate. She has led several projects, including 2015 population census, surveys, and studies using the latest technology. She was a member of the Statistical Committee to develop the National Statistical Strategy 2018 to 2025, and currently a member of the Implementation Committee for the project of monitoring Sustainable Development Goals, responsible for the development of the budget, roadmap, and requirements for project implementation. Over to Alan.
Yes. Hello, everyone. Thank you, Deputy, for introducing me. Bismillah ar-Rahman ar-Rahim. I am Ahlam Al-Rusan, IT Director at Department of Statistics in Jordan. First, I'd like to thank United Nations Statistics Division for inviting Jordan to participate and present at this UN World Data Forum in these challenging days impacted by the COVID pandemic. Today we will share with the audience the Jordan Department of Statistics initiative for COVID-19 Data Hub and the benefit from the integration of statistics and geospatial tools and how much this integration improves the dissemination quality which help decision makers. Next, please. A coronavirus response hub is a cloud-based community engagement and government platform that organizes and presents data and tools to the end users. Next, please. Here, I want to show you our example in implement the data hub. In this map, I want to show you one of the examples that we developed in utilizing population of 60 years or older. It's important to mention that this particular segment of population has special health needs and must have special care of treatment. Because of these special requirements, we developed a dashboard specific to this segment of our population by using data from different resources such as population of census and population of economic. As shown in map, it's present more than one information in one map, like healthcare facilities for protection from disease by using population census data, impact corona with population density, in addition of extent of virus proximity to hospitals accredited for treatment of corona. Such factors are essential to ensure there is reasonable access to medicine to take care of health so ministry can deploy resources to provide assistance. So we can summarize the benefit while developing this example by the availability of ready-to-use template to assist statistical office quickly and easily to build their own COVID-19 dashboard. Also, collaboration of statistical and geospatial community to help the disseminate data in high quality of easy evaluation and analysis, in addition of the dynamic data for improved dissemination methodology. Next, please. Department of Statistics website used to visualize many of types of data like population indicators, various surveys, statistical report, analytical summaries to keep up with current activities, opening channel with new types of customers to deliver the message in the correct form. So Department of Statistics has significant amount of data in its website. It's a challenge to easily disseminate data for presentment and understanding in any format. The dashboard added value by creating an easy-to-use visualization and presentment format, providing the capability to see, understanding, and analyze the information in much easier way. After basic training provided by UNSD, our team was able to use this technology to develop a path for integration between data and website, as we shown next, to the dashboard, which we found easy to learn and implement. So current DOS website now in progress to include maintain and delivered update on current situation. Utilizing embedded map in website for powerful visualization. Display data as soon as it is updated, providing value to website on the development of the virus. In addition of updates at the local and global level to present complex information in a clear and concise way with ability to analyze data. So in our website, we can see here how we can connect between the original website and the dashboard that we developed. Next, please. Using visualization here by using another example, and I want to show you another example in developing a dashboard for a census of agriculture. Census data is presented through graphic maps, the first of its kind in Jordan statistics. All relevant information can be seen on a single screen, facilitating a clear understanding quickly and easily. As shown in this ArcGIS dashboard, it enables users to convey information by presenting location-based analytics using interactive data visualization on a single screen and in different styles and formats such as pie chart, numerical, and mapping, with the very important additional capacity of providing dynamic change capabilities. So if the user select a change in any of attribute, the dashboard dynamically change the updates of all associated indicators and displays. In addition of the dynamic in data, so if any change in the source data, it will reflect to the dashboard dynamically. So our objective is to continue our development of the COVID hub to provide similar capabilities. Finally, we want to mention that the outstanding support provided by UNWDF and especially our primary contact, Mr. Daniel Shiti. The training provided was effective, well developed, and the format was very, very easy for our team to follow and start to use and implement. Thank you for your support and assistance provided by this project, and thank for Data Forum for this invitation, and thank all for your attention. Thank you.
Thank you, Alan. This was great. And she'll be joined with her colleague, Suhad Haddad, who's a GIS specialist during our Q&A session. So thank you. This was really amazing work that you guys have done. Looking forward to hear more on the Q&A from you. Our next presenter is Selassie Akaho. He's a developing spatial scientist with the Ghana Statistical Services. Over the past 3 years, he has been engaged in census mapping and coverage analysis for the 2018 Ghana Agriculture Census in one of the team leads for the GIS team for the 2020 Population and Housing Census. He has also consulted for other organizations on spatial mapping design, marketing, and web development needs. So, Selassie.
Hello, everyone. Good morning, good afternoon, and good evening, everywhere you are in the world. Okay, so data for effective response does not just look at the magnitude of any occurrence, but also takes into consideration the location and how the occurrence affects its neighbors based on environmental behaviors. Next, please. Okay. So in December 2019, the first corona cases were reported around the world, as basically in China. And then by the 12th of March, Ghana recorded the first 2 cases. And precautionary measures were put in place. Within a week, the trend of infection changed from imported, that's people who are arriving from other countries, to being recorded as infected based on contact tracing within communities. By the 30th of March, a lockdown protocol was implemented in Accra and Kumasi to curtail the spread of the infection. What informed this decision making in Ghana was how we gathered our data. So in Ghana, we gathered our data based on aggregated age, sex, education, population, location, geography, disabilities, migration, wealth, district, regional, and mainly our sources of this information are from surveys, censuses, and then the administrative bodies such as the MDAs and then the MMDAs. Next, please. Okay. On the geospatial part, we had support from the Ministry of Health, ESRI, GPSDD, FRAM, and then UCC, which is one of our universities in Ghana, in developing the framework for our hub and then our dashboard. Now, basically, the data for on the number of cases and then the trends of the cases was from Ghana Health Service, which were the mandated institution for coming up with the data. And the hub was built in such a way that it took real-time data from them or close to real-time data from the Ghana Health Service. And then we populated it and provided other informations that the public will need. In addition to that, there were other sensors or surveys run during the Corona period to inform on decision making, such as the Ghana household and job tracking, and then the Ghana business tracking. Our hub also was built in such a way that we looked at what data we could provide to the public, especially researchers who want to go into the data and then analyze for themselves what was happening across the country. Next. Next, please. Okay. So one of our interesting data was anonymized aggregated CDR data, which was used to analyze the mobility across the country. As our government statistician, Prof. Enimo put it, the observations on the dominant places of interregional mobility engendered the determination of the route to increase surveillance to ensure reduced mobility. Specifically, the high mobility between Accra and Eastern regions suggested a need for enhanced restricted mobility between the two regions. For interesting spatial information, population distribution, and the availability of health facilities to support case management, as well as vulnerability factors, were taken into consideration to look at where human beings are settling and then their pattern of behaviors. And we put it in a special form so that people can be able to have a fair overview of what is going on across each part of the country. So first of all, we looked at the population distribution, where we looked at the estimated population, the distribution of the aged, now then the population density, and then we related that to how many health facilities we have in those locations. Now, all this data was aggregated at a regional district level to prevent it from being very evasive. Now, the vulnerability factors that we looked at were the number of people who share the one-room house, and then where you have multiple households settling in the same one-room environment. So we realized that, okay, the more people you have sharing a room or a facility, the higher the tendency of the virus being spread across those people. And then with the precautionary measures being introduced at the start of the virus, which has to do with washing of hands and then the using of sanitizers, we also took into consideration how much water do people have purposely put aside for washing of hands, and even if they had soap for washing of hands as from our survey. So these were generally data that we put in a visual form for people to assess and then analyze on their own. And behind this data, there's always the attributes of numbers that statisticians can also run across other various for themselves. And in doing all this, we came up with the dashboard and then the hub that provided this information to the general public so that they can have a fair overview of what is happening in the country and then how best to organize themselves to prevent the spread of the virus in their own way. Hello.
Hi,
Hello.
Selassie, can you hear us?
Yeah, I can hear you. Can you hear me?
Yeah. Yes, we can hear you. Go ahead.
Okay, next, please. Okay, so this whole initiative was put together by Mr. Umar Seidu. He's the head of demographic statistics and SDG coordinator and demographic and social statistics for the Ghana Statistical Service. So this is just our short presentation on what we put together on our data hub and how best we as a statistical institution has put ourselves forward in tackling the case of the virus or in curtailing the virus within our country. Thank you.
Thank you, Selassie. That's some really, really interesting analysis and data access you guys have done. Very cool. So we are going to now move on to our last presenter for today, Macarena Perez Garcia. She's a geographer and has worked in the public sector in Chile at different headquarters with 11 years of experience starting in 2017. She assumed the role as Executive Secretary of the National Systems for Territorial Information Coordination, SNITSTI Chile, also fulfilling the role as Vice President of UNGGIM Americas in the period 2018 to 2021. In the year 2018 to 2019, she was appointed the role of Rapporteur in the 8th and the 9th session of the United Nations Committee of Experts. She has been a teacher since 2011, teaching courses related to territorial analysis in the undergraduate and master degrees. Macarena.
Hello, can you hear me?
Yes, we can hear you.
Okay, sorry, a little technical problem. So, good morning, everyone, and good afternoon. I just want to thank the opportunity to share all the activities that we're working on this emergency since March of this year. Next one, please. Next slide. Okay, a little bit of context. In general, as they say, I'm in charge of the STI in Chile. So we work with 12 ministers and another minister that are not part of this council, and we have 10 working groups related with data in different terms, standardized data, and other working groups related with image and different information. And one of these working group is related with the emergency and information to respond an emergency. So we support different ministers in the activities related to create dashboard, to create a map viewer related with some emergencies. This is the first, of course, this is the first emergency, this big, with this big activity, and we've been working together with the Minister of Health, who provide us all the data that we're showing in different dashboards. Next one, please. So we start working in March when the Minister of Health active this working group. And we set some map viewers that are not public. For the first month, we have chosen map viewer for authorities, where we can put all the information related with data, like base data, and then we start to improve this map viewer and decide to make it public. Of course, considering all the restrictions with the information and to protect the information, as you know, is very delicate, some of the information. So we have some public map viewers and some closed map viewers. So we create, I think this is like the third or fourth version of the dashboard that we create. At this moment, we have 1,718 visitors, so it's a lot. And for this dashboard, we work with a team of journalists and designers who help us to create a very easy to see map viewer. As you know, we're very technical sometimes, so we want to publish a dashboard that everyone can understand, and everyone can see the information that we are publishing every day. So in the next slide, you can see some image of the dashboard. The information that we have there is related with the quarantine zones and the program of the government named Step by Step, that is related with all the phases that we're. Every community is in a different phase, and every region is a different phase, so it's very complicated to understand. So here you can have all the information about the active cases, the cases are confirmed, all the information about the quarantines, about the restrictions, about the activities that you can do and cannot do in some parts of the country. And we have some information related with the confirmed number of cases to quadrants of 1 for 1 square kilometers. So that information is very important to the for the local authorities, because they are having some specific plans in some neighborhoods. For example, who can covered with some extra help that part of the territory. So we've been having a very big support, but the ESRI team here in Chile and the US, they always are very with a very good action about all the doubts that we've been having. And in the next month, we're planning to create a different dashboard related with all the activities and the economy that the government is increasing in some of the specific areas. So this dashboard has information that is updated every day. Some of the report of the Minister of Health has report twice a week, for example. So we have a very specific team that is working every day to create this information and to put this information on the dashboard. I think that is my time.
Thank you, Macarena. Really amazing work. I think it's showing more and more how timely data is relevant, and relevant data is needed at this time. And how you guys have been doing amazing work with the data hubs. You're making it available, and also not only just timely, but also keeping public involved and collaborating with various ministries and departments. So really great work from all the agencies here. I'll turn first to the questions that the participants sent in advance. So we'll start with some of those. So one question that has come is, what new and different data demands have you faced from the users after introducing COVID-19 Data Hub, and how did you cater to them? So I'm going to first give it to you, Selassie. Ian, just talk about what data needs you got from after this hub. Lasse, if you can unmute yourself.
Yeah, okay. So for our side, our main requests were based on people wanting the exact population numbers as at 2020, as in the projections we have now, and then a breakdown of the various cases into the least most possible numbers, as at a district level. Some requested for us to go down to a locality level, but then we told them based on the way we aggregate our data, the only way we could provide it to them is at a district level. So that's basically the new demands that have come. And then also, we've also looked at the various visualizations and then data requests based on, let's say, vulnerability indexes that we were supposed to generate for analyzing, to just give people a fair idea of what is happening and then where exactly is happening and then what they should expect to happen in the next few months.
Okay. Ella, do you want to respond to the same question as well on the data needs? Ella?
Hear me?
Yes, we can hear you now.
Yes, as shown in my presentation, I give example of the group 60 years and more segment. So this is one of example that demand from those to prepare in this dashboard. In this example, we apply that by collect data from 3 resources: census of population, and census of economic, and the health data from Ministry of Health. So this is help us to give them more visualization reports that help them in this maker.
Thank you.
Okay, yes.
Macarena, do you want to give some examples of what additional data needs have come for you for Chile?
Yes, so we have this base data in the working group of disasters that every minister has already prepared, like the base data of the administrative limits and the hospitals, and every minister has a base data that we already have, and we keep on preparing for every disasters or every emergency that we have. So at this, for this experience in particular, we have to build some indicators related with vulnerability or other indicators, and of course we are working with the statistics direction here in Chile, so we have these different types and kinds of data. Of course, we've been struggling. I think it's a global situation related by the data, and of course we have some issues with some of the data and the norms and standards, but we are always used to have that kind of problems.
Okay, thank you. Thank you, Macarena. I think we'll move to our next question. Yes, it is really, really important and relevant right now, the new data needs that are coming up. Another question is, how can data hubs be used for better monitor and compare changes in activity during different areas of the economy and society, as well as progress towards Agenda 2030? Again, Selassie, I'll ask you to talk about a little bit on how you were managing change in activities across different areas of the economy and society. How this data hubs can be used to monitor the change. Do you want to talk about, Selassie, about how you were doing the mobility and the change?
Okay, sorry, my mic was off. Okay, so first thing is data hub. So as much as we populate the data hub and then we have our interactive maps and then our various figures being shown. We must create this form of time series within our map that people can actually visualize the trend of the hotspots or the various cases as they happen, and then also providing them with enough information. So let's say with the interactive interface, once you click on it, you can get what is happening at that area, the magnitude of the case, and then the other factors of or demographic factors that are within that area that are likely to demonstrate the spread or the increase in the number of cases over there. So I think those features are something that we must embed into our data hubs and dashboards to provide timely data and information on what is happening where.
Elam, would Suhad would like to take this question on the GIS, how they were doing more monitoring and comparing on the from Jordanian side?
But you can reply.
Yeah, I will. Hello.
Hello, go ahead.
Yeah. We're trying here to develop data and reports or visualization map while we are in the pandemic, before or after the pandemic. We show a clear vision of the current situation and help the decision maker, because we integrate many data and we could link from another group or ministry, work to determine the most effective establishment, and within certain characters such as the number of workers and its impact on unemployment and its impact on society in the event of the choosing the establishment. In the future, linking them with the indicator of sustainable development, maybe in the future. Yeah.
Thank you. Macarena, do you want to take a minute to just respond to that on the monitoring, better monitoring and comparing changes?
Okay, so at this moment, we depend, the most part of the data is the Minister of Health that generate these indicators every day, and every a report, a specific report about twice in a week. And we also have the information related with the quarantines and the restrictions for some of the regions. So you can compare that information and see how is the evolution of this. I know that some universities and some centers of investigation are using the data that we are publishing, because this information you can access in different kind of reports, so you can use it to relate and create some indicators.
Great, thank you so much. And we're going to take this one last question from our previous thing before we move to the other audience questions. The question is, how can these data hubs be better standardized and set up to aid similar interpretation? So I'll give it to Alan and Suhad first on this one to speak a little bit better on the standardization with. Go ahead.
Yes, this is tools allow to prepare a template for specific topics. For example, COVID-19 ready and reflecting the variables from data living atlas for less than country or region. So that the ready template help in this by easy way.
Great, thank you. Selassie, do you want to speak about how these can be better standardized?
Macarena said we should have a template on the various data standards that we expect from every member country. And then also, we could also look at the visualizations of our maps, as in what color represents what. So whenever you go to any country's dashboard or data hub, you know that, okay, red means, okay, there's a place where a case is going high, and then what has to be done. And then also what we could look at is also coming up with a standard on vulnerability indicators, as in looking at what are the general standards across the world that we could use to indicate as a vulnerability indicators, and urge all member countries to try and gather data around that and then analyze that and use it to populate their data hubs.
Yeah, and Macarena, thank you. Macarena, do you want to talk about that, the work you guys have done and how you think it can all help more standardization?
Okay, I think this is like the third or fourth version of the public dashboard that we have. And we realized that, of course, we use a frame, an original frame that it was very simple because of the information that we can publish. So in every month, we have more information in different scales. So we've been improving how you see the information. I think one of the things that are a key for the success of this kind of dashboard is to work with different professionals from different areas, because we have a very big idea of how you show the information, and everyone are going to understand that, and that is not always like you want to. So we have a lot of different professionals looking at how we publish the information to make it easier. We have some private map viewers that are a little bit complex than this, because it's information that is private or on a different scale. So I think we always try to make it better and more simplified for the people, and because this is very successful on visitors, and we know every day people are looking at this to make decisions, not only the authorities.
Yeah, no, I got some really good points from, thank you so much. From there, I think, Selassie, you said that there is more standardization on the color scheme so people understand what that means. And Macarena said, like, getting templates out, which allows people to get the data out very timely manner. That kind of standardization is needed. And Macarena, from you also was a really good point on, how we make this data more standardized and make sure that it's available in readily manner. So really good points from all the panelists on this. I think these are all points we can all relate to and understand how this is helping right now. Last question before we move on, and I'm sorry I missed this earlier, is how can data hubs be used to better detect hotspots on new patterns in a timely manner? So are you guys, like, as the pandemic is progressing, how Data Hub is helping for doing hotspots and pattern detection in timely manner? Selassie, I'll ask you to answer this one.
Okay, so looking at the case of Ghana, we have gone the extra mile of running two other surveys. That's the household and then the business tracking surveys that looks at what has happened between the time of after the lockdown and then what is happening now in various communities and then districts across the country. So that's a new direction we have taken in generating extra data to support decision making on how the whole pandemic is affecting people, and then what decisions must be made towards those people, and then how best the country can move forward from there.
Okay. Elam, do you want to just take a minute to respond to this?
Yes, my colleague will respond.
So
Yes.
Yeah. So do you want to take
Yes.
Yeah, go ahead.
I'm with you. Here we found that modern technology is being used to support the effort and saving time, and this gives us the goal to reach the lowest geographic level and discover hotspots and reduce the effort in identifying these points by in the old method, going to the field and visit this lowest geographic. But here, maybe in other side, we work with the Ministry of Health to get update information dynamically and by integrate with the GPS and map of determine the location of infection population, maybe which help ministry to go ahead in their protection progress. Over.
Okay, thank you. Macarena, do you want to speak about the hotspot analysis? Go ahead.
Okay, well, for us, this has been a lot of work for the past month for me and my team. It was a really big challenge, but we've been working in this kind of emergency, of course, with this characters, but we've been working on this and coordinate different ministers and different data for me, the past 3 years. So we have the experience to create something like this, but this is the first opportunity that we have to create something for the citizens, something very useful. And for the future, we are working, of course, in the program step by step that is related with all the activities that you can do or cannot do, and a specific program for economy tasks that we have for the next year. So even the idea is to create another dashboards and related with some activities from economic that the government is improving.
Yeah, no, that's a great point. I think some of the things I heard from the whole, all of you was really, really important is you're trying to get not just reporting on COVID, but also doing decision making, or at least making data available on more local and granular level, so that the authorities can make decisions. But that is also bringing out trends on local geographies, on the number of cases, and they can make decisions on the lockdowns and other things there, but then also help that to drive economy. So really great points from all the panelists here. Thank you so much. And we are going to now move to the questions from the audience that have come in. So I'm going to take in the first question. This is from South Africa. So it says, as much as dashboards are useful for transmitting information to the public on various domains, it does not cover some of the demographic nuances around the magnitude of the COVID-19 and its various impacts. These technical considerations become even more magnified when displaying them at subnational level and over time. Any comments from the panelists? So I'm gonna first give it to you, Selassie, to talk about this.
So for our statistical service, we basically used a graded kind of data to make sure that everywhere is covered across the country. That means we didn't look at just where surveys data were coming from, but then based on those data, how do they relate with other districts? And then we came up with a graded data. And based on that, we re-aggregated it into the district level. So as much as possible, we tried to cover everywhere in the country and then make sure that the data we're providing is substantial to it. And then looking at the various demographics that we covered, we also look at what basically researchers were interested in and then what basically demands were on. So that was, our focus was more based on what data actually informs decision making, and that was where we focused on providing data for.
Okay, great. Elam and Suhad, would you want to talk about this on how dashboards are useful in transforming information to public in various domains, not in over time?
Yes, Suhad.
Talking about subnational level, Suhad, are you on mute?
Yes.
Okay, go ahead.
While we work with dashboard, they give us a new vision that there's many things we can do with dashboard. In the old time, we just prepare maps But by using dashboard, we have many things we could do it in one view that give user more practice with us that this data we will find many things in one dashboard. That's the way it's perfect, and we put this dashboard with hub sites. It's compatible with each other. That's a good idea that we could put dashboard in a hub site. But I ask a question: if there's more things, can we do it in hub site like dashboard? And another thing, we can put many iframe in hub site. But the main idea that we all the user like dashboard more than the other thing. Over.
Yeah, thank you, Suhad. I think very
Can-
good point you made. Go ahead.
Can I
Yes.
add just one statement about this? As much as cooperation between ministries and institutes, as much the benefit from this COVID. So if the resources of data from all sides, it will increase the benefit from this data hub. I think so.
No. Yeah, no, great. Elham, I think you bring up a good point that there is collaboration between agencies needed to make the relevant data available. And not only just that, but with the dashboard, you're able to integrate these different data
Yes.
sources in one place. So really valid point and great point there. Macarena, do you want to answer to this question?
Yes, I just want to point that in the beginning, in March or April, at this emergency, we couldn't share, for example, the information by square, by one square. At this point, we didn't cover, and the Minister of Health is covering all the country with this information, so people can realize and see how many cases are nearby, but the authorities can make decisions for every week about quarantines and other restrictions if they see some focal point or some critical areas. So I think it's very important to increase the information and publish the information for the community to understand this how it's getting worse or better.
No, great point, Macarena. I think a lower level data is needed to make locality level decision making and resource allocation. So absolutely relevant at this time during the pandemic. And this question that has come is for Chilean dashboard, but I think I would open it to all the panelists. So the question is, are the data feeds automatic from operational databases and transactions, or do they have to be fed every day manually? So Macarena, I'll start with you first on this answer, and then we'll move to the other panelists.
Okay, so unfortunately, I don't know if unfortunately, but we have to change every day because we are reporting, the Minister of Health has a daily report and epidemiology report that is twice a week. So my team work every day on the dashboard.
So is it automatic? How are you pulling the data from the ministry, I guess is the question. Are you getting data feeds from them, and how your team is pulling that? Okay.
They send me the data every day.
Okay.
But the data has not personal information about the cases. For example, I never get to see that. I mean the information of the people that is having the disease. I only can see the square.
Okay. So I guess the point here is that since you're getting it from another ministry, they send the data sets to you and your team uploads it on a regular basis. Thank you, Macarena. Salase, do you want to respond to this? How you are putting data into this? Is it automatic or?
So for our side, various demographic data are static. That means we just uploaded them once and then configured them. But then for the cases that the new cases and the number of infections, for those ones, they are linked to, it's automatic. It's linked to an operational dashboard from the Ghana Health Service. So our system is more automatic. We just do data checks to make sure that all the connections are working well, and then all configurations are looking good. Yeah.
Yeah, no, so that's great point. So you're pulling directly the services from the Ghana Health Division into your dashboard to show that data, but for your statistical data, you have uploaded it once and you don't need to frequently update. So that's a great point. Elam and Suhad, do you want to talk about how you guys are doing data?
Yes, this is from the first option and the very important option in these tools that they had the ability to connect directly with database, which means any update will be on the data will be reflected to the dashboard automatically and dynamically. We built a web service between those and ministries. So even the database that out of those, we can reflect the change automatically and dynamically to the dashboard. And we are in progress to do that for all of the survey and data in the data hub.
No, great. That's fantastic. So we are seeing that you're able to collaborate with agencies and you're able to connect to your database directly and automatically update it. So it's more relevant. That's fantastic. And so I think this is last question. So what resources do you need to maintain the database? Alam, your team can, Suhad, and you and Suhad can respond to that for the data hub.
Yes, it is many type of database. We use Oracle database, and we need from those we have a lot of data related to the housing and economic and censuses. But yes, we have a cooperation between us and other institute under our strategy.
Okay.
So we receive from Ministry of Health, Ministry of Planning, all ministries. We receive data by agreements between us anytime we need. But in these challenging days, we have some of challenges in getting data, actually.
Okay. Yeah, sensitivity of data is really important. So Salase, do you want to talk about what resources you guys need to maintain right now? So your system seems more automatic. So I'm curious how you guys are doing that.
So apart from the normal internet data we use, we need, I think, basically we also look at how timely the various data sets are updated by the operational body, that's the Ghana Health Service. I think they promised at the start to do it at a daily basis, but then as it stands now, sometimes we get it in an intervals of 2 days. So that's just the little hiccup that we have when it comes to the regular updates of corona cases in Ghana here. But then apart from that, we have almost all data sets, and we capitalize basically on the esri system. So most of our data sets populated on our dashboards, and then our data hub are all in file geodatabases, and then that's how we run our own. Thank you.
Thanks. Macarena, do you want to speak to this question on resources needed for data management?
Maybe just say that I see this experience from my country like an opportunity to show the relevance of the data and the territorial information and how you can make decisions with this information. So I hope in a different kind of emergency to this on, we can connect very automatic to some data of some minister, for example, and have we already have some protocols with different ministers, but I think it's important to work on that to have this information automatically.
Yeah, thank you so much. I think that is a very, very valid point, Macarena, that you just made. There is need for disparate data. Kind of key takeaways, the standardization needed on the hubs. There is collaboration needed between organizations to bring different kinds of data sets together. Even though there may be, some hiccups around collaboration and agreements needed, but I think it's becoming more and more apparent, especially from the work we have seen from all these three agencies today, our presenters, is that those collaborations are key to making this data hubs work. There is definitely automation possible for data hubs to work when you can pull direct services. So putting your data into services makes it even more useful and relevant and timely. So I would say that is another takeaway we saw, and also continued collaboration to do analysis, right? So the analysis more to the granular level, so local level decision making can happen. So that's also another key takeaway we got from it. So thank you so much for all our presenters today, and also the participants who have sent in all their questions. So these have helped us form our conversation today. So thank you so much. And stay tuned for the 2020 Virtual UN World Data Forum registration opening in September, and follow the website and the Twitter for updates. The Twitter handle is UN Data Forum. And after this session, we are going to be on the Twitter right now, discussing more and taking more questions. And posting out more things. At 15 minutes at 10:30, we will be starting our discussions in the Twitter chat. So for Open Data Watch and geocensuses. So thank you so much for joining our webinar today. We really appreciate your participation. So with this, we'll end our session today, and we'll see you in about 15-20 minutes on the Twitter.
Thank you, Deputy.
Thank you all. Bye-bye. Take care.
Bye.
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 Thank you all.